I am an internal medicine physician. I became an internist because of the fact that I love working with adults. Internal medicine is actually adult medicine. It's a specialization in adult medicine. We differ from family practitioners because family practitioners do take care of children as well as some obstetrics, but internal medicine training is solely geared towards adults. And adult diseases fascinated me during my residency, and I chose adult internal medicine as my career. Primary care physicians have a huge role in preventive health. We all know that you come to your primary care doctor if you are sick, you have sore throat, you have a flu, you have sinus infection, or you come to have them take care of your chronic conditions like diabetes, high blood pressure, cholesterol, and asthma. What patients don't realize is that we're also there to be your preventive health physician as well. And it's important to come in once a year for your annual physical. Annual physical is something that that women especially are familiar with when they go to their gynecologist, when the gynecologist does a pelvic exam and pap smear. That does not replace the annual physical that your primary care doctor does. With your annual physical with your PCP, we focus on immunizations and make sure that you are up to date on any current recommendations for age-appropriate immunizations, as well as cancer screenings that may not involve just gynecological cancer screenings. If you don't come for your annual physical, you may miss out on some very important tools in keeping you healthy. Cancer screenings are very important. Let's define what screening means first of all. Screening is actually looking for a disease before you have symptoms. So it's done earlier than symptoms present themselves. Most early cancers do not present with symptoms, and therefore the only way to diagnose a cancer in its early stage is through the screening itself. There are a lot of different organizations that put out guidelines for cancer screenings. However, most primary care physicians tend to use the guidelines set forth by the United States Preventive Services Task Force. The task force is an independent agency. It's not a government agency. They do not do research, but they actually combine, look at and research and analyze all the research and come up with their recommendations based on benefits must outweigh the risk in order to recommend a cancer screening. They also recommend that each physician have a dialogue with each patient to determine what is the best screening and what may be your risk factors in order to delineate what is important for age-appropriate screenings. The United States Services Task Force is important because many of the public insurance companies, as well as private insurance companies, Medicaid, Medicare, as well as the U.S. Affordable Health Care Act, are using their recommendations in order to pay for cancer screenings. Colon cancer screening is recommended for both men and women. Most colon cancers are found after the age of 50. Therefore, current guidelines set forth by most organizations, including the task force, all agree that colon cancer screening should start at the age of 50. It's important to keep in mind that this is for patients who do not have risk factors or symptoms. If you have a family history, if you have other risk factors, other diseases, then these screening guidelines do not apply. That's why it's important to also have this dialogue with your primary care physician. The gold standard for colon cancer screening is a colonoscopy. This is done by a specialist. Colonoscopy has increased the rate of survival for the 5-year survival rate for early diagnosed colon cancer to almost 90%. So it is very important to get this colonoscopy done. Cervical cancer is one of the most important cancers that screening is available for. Cervical cancer at one time was the leading cause of cancer deaths in American women. However, over the last 30 years, the cancer deaths from cervical cancer have decreased by almost 70%. Most of this is due to the pap smear, and now the human papillomavirus vaccination will reduce this even further. Current guidelines recommend that pap smear and HPV screening be done at the age of 21, and from 21 to 29, it should be every 3 years. Then from the age of 30 to 65, the pap smear should be done every 3 years as well. However, other tests can also be done in addition to the pap smear, such as the HPV testing, and the interval can be increased. I have both men and women patients, but I do find women's health quite fascinating. Diseases are different in women. Heart disease can present differently in women. There are also many diseases that are predominantly found in women, or there's a higher prevalence of in women. For example, osteoporosis, as well as depression, has a much higher incidence in women than men. These interests me in particular because I'm a woman myself, and when I look at my health, I am interested to know what I am at more risk for compared to what my husband might be at more risk for. Therefore, I really do like the women's health issues and find them very interesting.